Okay. Hi, everybody. I'm Julie Willoughby, representative from District 13, which is Chandler, Gilbert, and Sun Lakes. I appreciate Amy and Brandy putting this together at such short notice. The genesis of this is because the changes that have been rolled out from Access and DES um, are concerning, and we've heard from you that it's concerning. I'm trying to get some better information to you on the 1115 waiver. So I have reached out to somebody that I have the utmost respect for that has information about 1115 and has done an 1115 waiver before. She's going to open it up. Her name is Beth Kohler. She's going to go ahead and kind of describe the expectations of an 1115 and exactly what the process has looked like in the past. With that, we will have Senator Janae Shamp on the line. She apparently had lost some power at her home, so she's going to log on in a minute. She will be with us. And then also Representative Nancy Guttierez will be joining us as well. There are a long list of questions that we have from all of you that we are trying to get to. Some of them are duplicative, and some of them, to be honest with you, we won't have an answer for you today, but I will do my best to find answers and get them back to you. I really do appreciate the time. I understand that we're up against a time limit with October 1st around the corner, but I just want to be able to help supply some peace of mind with some information on the facts of how this looks moving forward. So with that, when Janae gets on, I should say, my background is nursing. I did trauma ER, I've done administration, I've been a chief nursing officer. So I understand this in a different light than I think a lot of other individuals have experienced. Janae Shamp is also a registered nurse. So she will also have some concerns because we've seen the ages and the breakdown and how they just don't necessarily correlate with anything that we are used to in healthcare. So I want to bring that up to you. I also want to point out that sometimes um, ultimately, the legislative body is a group of representatives from the community. A lot of us are just people too. We're not experts in a lot of the fields, but we try really hard to be the experts for you on your behalf when things like this come up. So please do remember that there's just going to be some things that we're going to try to help get answers for that we just won't have today. So with that, I'm very excited to be here. I appreciate all of you taking the time. And then I'm going to hand it over to Beth, who will introduce herself and then kind of go through the expectations of 1115 waiver.
Okay, great. Thank you, Representative Willoughby. And thanks to everybody on the call today. So my name is Beth Kohler. Representative Willoughby and Senator Shamp asked me to come here. I am a consultant and serve in a number of different capacities. Some of you may have seen me down at the legislature in my role as the CEO of the Arizona Association of Health Plans, who are the private sector access contractors. I want to be clear as part of this, I'm not representing the Arizona Association of Health Plans in any way. I'm here, at the request of Representative Willoughby and Senator Shamp, because I have a long history working in the Medicaid program here in Arizona and in other states. I've worked both down at the legislature. I have been the governor's deputy policy director, and I was the deputy director at Access for about 7 years. And so I have experience personally developing and negotiating 1115 waivers with the federal government. And so it's in that capacity, with that experience, that I was asked to be here today and to share some information with you all. I know there are a lot of questions. I was down at the legislature during a lot of this debate. You may have seen me get up and talk conceptually, similarly, about processes, capitation rate setting, waiver development, et cetera. That's kind of the lane that I try to stay in. I can't answer questions about what's clinically appropriate for service delivery or any background on how the state agencies made the decisions specifically contained in the policies, but I can give you a lay of the land about how the waiver process and the policy development process works. And so I'm going to attempt to do that in a little bit of a high level overview, and then I know there are questions. So I will start high level and brief, and then we can go back and forth with additional information as needed. So I was asked to talk about the waiver. The waiver document for access is hundreds of pages long, and it lays out the parameters for the program to operate whenever the program is operating in conflict with federal law. So federal law sets out requirements for state Medicaid programs overall. And then it allows a process for the state to say, we want to do things differently than is authorized under federal law. So a lot of what Access does is consistent with federal law. And they have extensive governing documents called the state plan that outlines how they're going to conduct business as it aligns to federal law. The waiver are those areas where the agency departs from what is required under federal law. So, for example, federal law does not contemplate services being delivered in the access model for the broader program, not specific to DDD, does not contemplate services being delivered by private companies. Access has a waiver, a long-standing waiver since it started to operate that way. Similarly, home and community-based services overall are not a mandated service under the state Medicaid program. So Access has a waiver to say, rather than serving people in nursing facilities and intermediate care facilities, we want to deliver services in the home and community. And so there is a waiver process to do that. And then to put an even finer point on, federal law does not contemplate paying legally responsible adults for services. And there is a waiver provision that says, okay, despite federal law not contemplating this, we're going to allow you to do this through a waiver process. And what has to happen for a waiver is that an 1115 waiver is a demonstration waiver. So the state says to the federal government, let us test that providing care in the home and community works better and is more cost effective than providing care in what federal government calls an institutional setting. Let us prove this to you. And we will do that because we will offer these services, and then we will track how much these services cost, and we will forecast what the services would have cost in a different setting or through a different service delivery manner, and we will show you that these services are more cost effective. So backing up, the state formulates a hypothesis of how it wants to deliver services that is different from what federal law contemplates. It develops the waiver proposal, often with stakeholder consultation, and it identifies for the federal government the policy goals it is trying to accomplish. This is just a basic waiver. The state has to put out that draft proposal, hold at least 2 public hearings, and provide the public a comment period on the waiver language itself. Once it is submitted, the federal government also provides an opportunity for federal comment period. And the waiver request will lay out, again, what the program is, how it differs from federal law, any changes it's making to services offered generally, who's getting those services, and the financing of those services. So CMS gets that package document, says, check, you've included all the things we want you to include. And then they start evaluating whether or not they will approve the waiver. So that is a highly subjective process within broad parameters. And CMS often goes back and forth to the states and says, okay, excuse me, you want to make this program change. We're not comfortable with that per se, but here would be a pathway that you could do something like this. So a good example is the state a few years ago wanted to start paying for housing related services, support services to help people with serious mental illness stay stably housed. Those individuals are not in the All-Tex program, not in the long-term care program, and they wanted to add this extra benefit. And CMS, it took years, some of this, said you can do it this way, you can't do it this way. You may have heard down at the legislature, there was approval for traditional healing services for Native American members. That waiver was initially submitted, I think, when I was at the agency, and I left the agency 8 years ago, and it just got approved this year. So these processes can take a long time to demonstrate to the federal government, again, that not only should they be permitted, but that funding should be provided. So that is a negotiation process. You saw under the Biden administration a much broader willingness to authorize services that historically haven't been authorized under Medicaid, including the Parents as Paid Caregiver service. But it really has fluctuated. For example, the Trump administration early on put out a notice that they would no longer be authorizing some of those housing type waivers that I just mentioned the state got a few years ago. They put states on notice to say, we don't think conceptually these are cost effective and in alignment with what we are trying to achieve with the Medicaid program. Do not expect us to allow you to continue to do this. As part of that, they also said, here's a funding source we let you use for these housing related services. We will also not allow you to continue to do this. So a lot is at the discretion of CMS and how they feel comfortable interpreting their authority to authorize these waivers. So the state submits, they demonstrate all of those things I mentioned, CMS reviews it, and as part of the approval, CMS will institute reporting and evaluation requirements. Those typically require evaluation of effectiveness, et cetera. A large part of the waiver process that you've probably heard about is budget neutrality and cost effectiveness. So federal Medicaid spending under a waiver cannot exceed what federal spending would have been without the waiver. And there are complicated federal calculations about how to achieve that. So for example, home and community-based services as a whole cannot cost more money than what you would be paying if people were in institutional setting, which again is the default mandated Medicaid benefit. And so there are very complicated technical calculations about how you demonstrate. That is another thing that historically has been very political in terms of how CMS has calculated that. But HR 1, the one big beautiful bill, actually for the first time put details and expectations around budget neutrality and waivers into the Medicaid statute and really tightened up and removed the flexibility CMS had to authorize some of these waivers and how they can be demonstrated to be budget neutral. Underneath all of that are requirements for cost effectiveness. They're interrelated, but they are two separate things. And the waiver requires for HCBS services overall to be calculated to be cost effective on an individual basis. The waiver says, like on an individual basis, the services authorized for members have to be less than what they would be if that member was being served in an ICF, for example. So there's a lot of federal checks and balances to make sure the federal government is not paying more for these services than they would without the waiver. So what happens if CMS, or sorry, before I go into that, CMS monitors this on an ongoing basis. And there are hundreds of pages in the waiver outlining what CMS is going to look at, how they are calculating this budget neutrality and cost effectiveness analysis. And they can at any time go to the state and say, you're looking like you're not meeting these. Typically, what would happen in that case is CMS would require the state to come up with a plan for how they would demonstrate they are meeting those federal requirements. And so strategies they might say, you need to modify your service delivery. They may say you need to submit a corrective action plan to us. You should cap enrollment because, as you know, in many other states, HCBS services are delivered with enrollment caps and the like. Arizona has a pretty open-ended enrollment policy compared to other states as it relates to these specific Medicaid services. So they may say you should consider these things, or they may say, you've got to tell us, state, how you're going to bring these costs in line with our targets. And waivers are renewed. Typically, it varies. There's a lot of technical nature here, but the last time Access got a 5-year approval for its waiver, and they will submit a new updated waiver, that process to negotiate. So if the waiver ends in 2027, they will submit something formally to CMS typically in 2026. And that whole sort of public comment and negotiation process occurs over that last year of the old waiver going into the new waiver. So that was a lot. I want to pause right there. And Representative Willoughby, I see you have your camera on. I want to see if we want to have any discussion or questions about what I've covered thus far.
Absolutely. And Beth, thank you again for doing this and taking the time, especially with your experience of doing this before. It's appreciative. There were some questions that were submitted before, and I should say there were a lot of questions submitted before. I don't know if we'll have the time to go through all of them, so I picked a few out that I would like to ask you about, see if you can help maybe help us gain some understanding. The first one is an age assessment part of the waiver?
That is a good question. And I want to also, this gives me an opportunity to back up and say, the waiver is a very high level governing document for these services. It is very rare that the operating details are included in the waiver. In some cases, they may be, but most of the things, and the things that I've seen come out on PPCG, and I have not, again, engaged substantively on the policy decisions in there, those are all policies that are effectuated under the authority of the waiver. So those are not waivers themselves, they are policies. But what happens is the state looks and says, every policy change and waiver change is reviewed thoroughly by the legal team to see whether it comports with the requirements of the waiver. So when you say our age requirements, age assessment, I don't think the level of detail that you're asking about is necessarily in the waiver, but I would need to look and be able to answer specifically like which specific ones you're talking about to be able to tell you.
Okay, thank you. Can you share more about the flexibility states have to modify their waivers?
Yeah. So states have policy flexibility. They have to go through that process of demonstrating to CMS what we're doing aligns with the goals of the Medicaid program generally. It's going to deliver services in a way that is cost effective. But states have, and that's going to meet budget neutrality and cost effectiveness technical calculations. States, within those parameters, states can design waivers that work for them. As I mentioned, in many other states, they use different waiver authorities and establish individual programs, sometimes by diagnosis, sometimes based on a fund, we have this amount of funding, we're going to design a program that fits within this funding, and we're going to limit the services we offer or the people who can get those services. So there is some flexibility there. But again, it all has to live within the rubric of aligning with the goals of Medicaid, not costing the federal government more than would exist without the waiver, and being cost effective.
The next question is there a chance that these waivers will be denied? Can families call for reform, and should we brace for more cuts? I know that one's a little bit more specific than probably what you were here, but I think you can answer at least a part of it. What to be fully denied, what would that take?
So, as I mentioned, I think the most likely thing to happen if CMS is looking at these policies and saying, it looks like we're spending a lot of money, they would give the state the opportunity to propose changes to the waiver that would demonstrate they were living within their means. When you say, can families call for reform? If you're asking if families can go to CMS and ask for reform, I will tell you CMS doesn't typically dictate to the states, like, you should do this differently. CMS will tell the states what you're doing doesn't comport with federal law, but they won't, for example, push the state to create a program that it doesn't have typically, or expand coverage that it can't afford to expand or anything like that. They typically won't do that. But what they will do is ask questions. When I was at the state, there would be times when CMS would be reading news articles, and we would get a question like, "Hey, can you tell us what's going on in this state? Because this news article is, we're curious about kind of what's going on in your program based on what we're hearing from external parties." So that kind of dialogue happens on occasion. And I'm sorry, what was the last part of the question?
Should we brace for more cuts?
Oh, well, so let me take 2 minutes to sort of talk about what's going on in the Medicaid program writ large. And this, again, is not in any way specific to DDD or parents as paid caregivers, but there is a ton of dialogue that I'm sure you've seen on the news about Medicaid spending overall and the desire among both Congress and the current administration to make sure they bring down the trajectory of the growth in Medicaid spending overall. So there are a lot of changes they made to the non-All-Tax, non-DDD parts of the program related to additional documentation that people will need to get on the program, lowering the amounts that can be paid out to certain providers. So there is just a ton of dialogue right now happening around Medicaid. At the same time, the state budget is, you know this better than I do, pretty lean. So I think as someone who managed the program through the Great Recession, I am always sort of on alert and always think there is a possibility that when the state faces a lot of budget stress, we should all be looking at what strategies policymakers are going to use. I have not heard, and you guys again tell me, that DDD or this program, there was a lot of discussion in the last legislative session, but like at a national level, I haven't heard a specific state should go in this direction to make their cuts. But I just think there's just so much churning right now around Medicaid is spending too much money and we have to get it under control.
Thank you. Are there any other waivers Arizona could apply for to fund DDD, especially for younger children?
Any waiver that the state applies for is going to need a state match. And so the waiver, again, is that like technical mechanism to effectuate it, but you're still going to need to put up the same amount of state money for whatever waiver that you come up with. And so you could use a different, we use an 1115 waiver Some other states, the ones who do those capped programs, use something called a 1915 waiver, but that's just like the statutory authority for the waiver concept. None of them offer federal money without state money having to be put up.
The next question we have is, and this might be a little bit, like I said, again, out of your preview, but we'll give it a try. Did DDD all techs drastically reduce hours because this waiver is required, or did they choose to? So I know that you're not part of the decisions that were made on that, but in the past,
Right.
when you've gone through this,
I can't what I don't have visibility into is how close they think they're getting to budget neutrality targets or cost effectiveness targets. So I really can't say, but these are the considerations: is direction from the legislature, their evaluation of how close they're hitting those targets. And I just don't have visibility into kind of like what drove that.
Thank you. If the community pushes back, is there a risk that CMS will deny the waiver renewal just for pushing back?
No. And if that's what's being heard, I think maybe there's a little bit of if I can be a translator, it goes back to what I mentioned, where CMS does a lot of times take a closer look at things if they read a news article. That shouldn't be any direction to you all that you shouldn't use your voices. You don't have a right to use your voices. You absolutely do. But I'm wondering if people have heard that CMS might deny it for pushing back. No. But I'm wondering if the state is doing a calculation saying we're kind of approaching some of these limits and it might have greater scrutiny. Also, you do get greater scrutiny of whether you're hitting those limits as the closer you get to the end of the waiver term, which we are approaching. So again, trying to maybe do a little translation here. I can't say, but typically, you are free to use your voices and advocate.
Thank you. Yes, absolutely. How does CMS determine if a waiver will be renewed? You've touched on this quite a bit. We know that it's a long, lengthy process, and that application starts a year before it even expires. Right. So is there any more specific that you might want to add to that question?
Yeah. I mean, again, so they'll look at a lot of things, right? They'll look at the evaluation results, preliminary evaluation results. They'll look at all of those finances. And then again, they will look at the administration, whatever administration we're in, their priorities, and where they want to focus the federal resources. So I've already given examples of where the Trump administration has come out on the front end and said, not those. Those do come into play. And so I can't say how they'll approach this, but these are the types of factors that they look at when they're evaluating whether to renew it.
Okay. Thank you, Beth. We're at a half-hour mark. I want to be respectful for everybody's time. So I think those are the questions we have for you. Is there anything else you want to add before we go into some of the questions that I will try to attempt to answer as well?
No, thank you. And you know where to find me. Anybody can reach out if they have additional questions. Do you want me to stay on or should I take my leave?
It's up to you completely.
Okay. All right. Thank
you, Beth. Appreciate it. I hope that was helpful to you all. If there's additional questions related to that, there is going to be a survey at the end. Randy's going to put out that you can ask some more questions. We'll follow up. I'm going to go through some of the additional questions that would not have been directed to Beth, but probably more to myself, Senator Shamp, or Representative Guttierez. I'm going to go through, there's quite a few. So again, to be respectful of time, I'm going to try to go through as many of these as I can in order. First question is, in defining extraordinary care, did Access medical directors consider realities in schools? I can't answer that question. I do not know. I wasn't in the room when they were making these decisions. I know that both the agency and DES came together to make these changes and to offer them up. But as far as the more specifics of what happened in that room, I cannot say. With cuts to attendant care and HAB, won't families need help in other areas that the state will have to fund? This is one of the things that Janae and I were actually, Senator Shamp and I were talking about last night, is preventative care is so important and sometimes is overlooked with its importance. And it is typically, from a healthcare perspective, cheaper to do preventative care than long-term care. Now, do we know what we will see with the changes? Not necessarily. I don't know if these thoughts were discussed during the time that they were making these changes or offering these changes. But yes, I personally believe as a healthcare individual that we will see different issues that will come from kids not getting the care that they need that will then fall back up on hospital facilities, rehab facilities, families, primary care doctors, and et cetera. How are you going to advocate or negotiate for exceptions or true person-centered plans? So a couple different things. I want to make sure that we're all aware. The legislative body is not in session right now. There's no bills or ideas or laws that we can offer up outside of session. Those are the constraints that we have to work in. We are also legislators. We're not enforcers. Any laws that we offer and that get signed into law are upheld by another entity. That's the way that the government's been set up for fair and balanced treatment. So with that, there's not anything as far as a bill that we can offer at this point in time. What I am trying to do is to hear from all of you, and what Janae Shamp is doing and Nancy Guttierez is doing. We're trying to hear from you. So that way we can gather this information. We can go back to the agencies. We can go back to the governor's office and say, hey, these are the concerns we're hearing. Is there something that we can do? What are the negotiations that can happen? So we are working on that. If there's something that comes from this, that there is legislation that we will be able to propose, then I'm sure that we will work on it as soon as January happens. And we'll continue there. Nancy, yes, please. Sorry,
Thank you.
Representative Guttierrez, I apologize.
No, Nancy's good. I don't need to be formal, but thank you. Thank you for doing this. Thank you for inviting me. And I do just want to speak to that question quickly, that I have been meeting with the agencies and the governor's team, and I've invited Brandy and Amy there, and we've had meetings raising up these concerns. And Brandy even gave the agencies a list of not demands, but suggestions. And I have followed up, but have not heard back, but I will absolutely loop you in when I do. So those kinds of things, which you're right, with Willoughby, that's all we can do right now. And we have absolutely continued our advocacy for the families. And just real quickly, I want to go back to the people raising their voices with the CMS waiver. I think the concern has been from the governor's office that it's not about wanting to shut people down. It's about saying, if we have to prove that this is a cost-effective program in order to get these funds, like Beth was saying, when there's things in the news, the feds are going to say, is this cost-effective? And I think the governor's office doesn't know necessarily if they will be able to continue to say it's cost-effective, if that makes sense. But I understand how it felt that maybe people were being asked to shut their voices down. And I hope you all know that we would never abide by saying that your voices should be shut down.
Continuing, sorry, got dark in here. Sorry, I apologize for that. Is there anything that the legislature can do to help our kids? I apologize again. Without session, our major tools are law and bills and addressing it that way. What we have outside of session is this type of meeting, meeting with agencies to ask if they can make changes outside of this. And I know that a lot of us have been doing that and will continue to do that. Your kids are very, very important, but not just your kids. The entire program is very important. Any individual that is requiring assistance is very important. And I promise you that we will work our best to figure out what we can do here. What is the process to postpone the October 1st rollout? I've asked a couple times to several different entities, what can we do? So HB 2945 did have an October 1st for implementation of the assessment tool. I have asked them if implementation of the assessment tool and execution could be different. I have not gotten a direct answer yet. One of the responses is it's based off of the 90-day review. And so if someone has their 90-day review due in December, then yes, technically they will be delayed in the assessment tool on them. But if somebody's 90-day review is October 5th, then they will see this assessment tool earlier. So I'm waiting to see if that they're willing to push this back out to give people more time to find the appropriate resources after they've been assessed and they know what's happening. I do know that they will be offering an appeal process. What that looks like, if it's different than it currently is, I cannot say at this point in time. I don't know. But there will be an appeal if there's something with your support coordinator that you disagree with. My understanding is the law does not impose hard age limits. Can this be challenged? You're correct. 2945 did not offer age limits. This was something that the agencies came up with together. Can this be challenged? I'm not sure in what way we're speaking of challenged. I know that the community has brought up some concerns about legality. In those arenas, us as legislators cannot participate. But those are things that as a community, if that's what you choose to do, then that is the path that you all take together. I'm not sure. I'm going to ask this question, and I apologize if somebody feels this way, truly. Why are Republicans so against helping disabled individuals? I don't think there's anyone that's against helping disabled individuals. The growth in the program was dramatic, but we also know that diagnoses and tools to diagnose individuals with disabilities have improved over the years. Anytime you see a large jump in numbers, it immediately raises flags. And this is true for any line of business, any government agency to look into. I want to let you know that we all did come together and we did pass 2945 to do this. What you're currently seeing is from the agencies. This is not a partisan issue that's coming. This is coming from the Access, and this is coming from DES, and those are not Republican-run agencies. Do each of you review JLBC reports? What data sets are you using? I can't speak for everybody, but yes, I do go through the JLBC reports and read through them. That is what I'm told. There's some reasons within Access actuaries that the information is lagged dramatically. I have asked, and I'm waiting to hear a response on if there's anything we can do to change that lag, to streamline it, to make it faster, to get the information more accurate and more timely. Again, I am waiting to hear back on that. Are there funds being used elsewhere that could fund DDD services? That I can't necessarily answer because there's a lot of legality with this, because it's a matching from the federal government that we see that helps support this. There are still agencies that we still need to fund in addition to. That is something that I know that we've been trying to brainstorm on and see, but there's not a change we can do outside of the session because the budget is set and those funds are written for each agency. So it's not like a home budget where you can be fluid a little bit and move money from one account to another. That's not the way it works within the government budget. Once the money is set for this line of service, that's where it has to stay. What can be done to revise the budget to fully fund DDD without slashing services? Again, outside of session, we can't offer any changes to the budget. As far as the services, those changes were made through Access and DES. And those are what we're pushing back right now, and the implementation is so that we can see exactly what's going on and helping everybody get through. We're getting a little bit further into this. I'm going to take a couple more questions and then leave it open to Senator Shamp and Representative Guttierez if there's anything they want to add. How do HAB hours align with employment first goals? I have not done enough research into this to compare them, so I apologize. I do not have that answer. How does the legislature plan to preserve Arizona's 1115 waiver? We don't have control over the 1115 waiver. The application is done through Access and then reviewed through CMS. Why make the process so cumbersome for families already overwhelmed? That would be as the process I don't have oversight of. That's through Access and DES again. We can talk to them about streamlining it, moving it forward. I'm assuming that if they could make it more efficient, that they would want to as well, to make everybody's life smoother. I can't speak directly to that, but that would be my assumption. How will children be kept out of institutions without HCBS? These are resource tools that I want to be able to help find for everybody. I know APAD is looking into a lot of that, with some of the services being gone. What are the alternatives? Where are the resources? What can we do? Those are the kind of conversations that we're still having to get those answers to you, and I will work hard to get those. I will communicate my best through Brandy and Amy to relay that information back out. But there are, we are looking at what different resources we can offer. So with that, Representative Guttierez, do you want to go ahead and add anything there?
If I can get my microphone back working. Thank you, Whip Willoughby. You did just a phenomenal job with that. So I appreciate you. I would have had the same answers. We aren't the body that puts these constraints in. I will say that even with these constraints, I know that in this coming budget, so we will need a supplemental in FY26, which means extra money that wasn't budgeted, of about, I think, $50 million for this program as it is. So, it's costing more than we even budgeted for. And by no means am I justifying these cuts, because I had nothing to do with them. And we are working to make them less harmful for families. But I do think it's important that people know that, we budgeted, I don't remember what Willoughby, it was 300 million, was it?
I
I'd
think a
have to
little
go
bit
look.
more. Yeah.
Little more. And now, even this year, last year we had to do $110 million supplemental. This year, even bumping the budget up for this program, we'll need another, or at least $50 million, which, we had, Whip Willoughby and I were like, no, really, how much is it going to cost? We need to budget that much. And we thought we had. And now, because the amount of people using the program has even gone up since April, that's going to cost another $50 million. So, yeah, that's where we're at. And that's why we're at the place where we are now. And that being said, we will continue to advocate for the families getting everything they need for their children, and adults. So that's all I've got.
Thank you, Representative. I appreciate it. With that, I'm going to hand it over to Senator Shamp if there's anything that she wants to add in. And then just to everybody remember, there will be a QR code here at the end, so don't hang up right away.
Thank you so much, Representative Willoughby, for pulling this together so fast. And Representative Guttierez, thank you for saying the word advocate. The one thing that I want all the parents on this call and all the parents involved in this community that are taking care of children that are within this scope, we are here to be your advocates. Representative Willoughby and I are nurses first and foremost, and advocating for you and the care that you need is absolutely at the top of our priorities. And we were having a conversation yesterday how sad it is that government does not take into consideration how much prevention can alleviate stress costs, absolutely everything on down the line. But in government, for some reason, we don't seem to look at that. I do take it as a personal job of mine to make sure that I'm educating all of the senators on my side of the courtyard that this is a healthcare epidemic that we're looking at, and we need to make sure that everyone is provided with the tools that they need in an appropriate fashion. But as legislators and as stewards of the taxpayer funding, we also have to make sure that we put parameters so that there isn't fraud, because I don't want someone to be able to come in and claim fraud simply because we see an 800% increase. We need the data, and that is one of the things with the assessment tool, and that was why it was written so that it would come out so quickly, so that we can start assessing what are the diagnoses, what are the programs that are working for that diagnosis, what are the needs for that diagnosis, and putting, and I think we all know that putting age, qualifications does not fit with this community. We're not talking about normal development within pediatrics or adults, and so I guess what I want every mom and dad and caregiver out there in Arizona that is dealing with this very tenuous situation is that we hear you and we're doing everything we can within our powers. And I appreciate Representative Willoughby talking so much about what it is that our abilities are. But I think if any of you have ever watched me and paid attention, that I can be a squeaky wheel and the squeaky wheel gets greased. And so I will not let up on this. We are here in this with you. We are your partners and we will continue. You have my word. So that's all I have. Thank you so much again, Representative Willoughby and Brandy and everyone for coming together so quickly on such an important issue.
Yes, absolutely. Thank you very much for all being there. Brandy, I know that you put a lot of work into getting this together so quickly for me when I come to you and I ask, and I really do appreciate that. I want to let your community know that you are truly an asset. I don't know how much you guys all have worked with Brandy. I've only known her for a short amount of time, but I've been incredibly impressed with her tenacity and her determination to support you and to give you guys a voice. If you could elect her into a position, you'd find that she would be a great person to represent you in any kind of way. With that said, Brandy, I'm going to hand it over to you or Amy to wrap it up. And I do appreciate everybody's time. I hope that this was helpful. If there's anything else after we're done with the survey, I will try to get some questions back out to you, or some answers from your questions back out to you.
Thank you. We really appreciate your time. And what we have seen this last year is a lot of heartache in this community. But we've also seen some beautiful connections and bipartisan work, and that is thanks to the people that are in this space today. And so first and foremost, thank you for that, of showing us that people do matter over the politics, and that we really appreciate that being evident in the work that you do. I did share a QR code for a post survey that I'll get back to Representative Willoughby, so that she can, see kind of where our community is, what would be helpful from the legislative perspective. And I'll share that with Representative Guttierez and Senator Shamp as well. Amy, did you have anything you wanted to add?
If I can get my mute off. No, I'm so appreciative of your time, legislators. I really, I'm so grateful. I'm very grateful for all of the collaboration that I'm seeing, especially bipartisan collaboration, like Brandy said. That's something this one over here really demands, actually. So I'm just, trying to give her the voice. But the education was really incredibly valuable. That was a super solid training for all of us. I think that's really important that we have that level of knowledge of these systems that are impacting us so greatly. So thank you for thinking of that, Representative Willoughby, for considering bringing that to the table for us so that we would be adequately prepared and with the knowledge that we need. I also just want to say thank you so much for Senator Shamp, you as well, for your passion in advocating for us. It means the world to each and every one of us. I think that what we're asking for is simply a compromise. We're definitely not asking to wipe the slate clean from these policies. We're just hoping for some version of compromise. And I've seen it happen in government before, and I love that. So I think it can happen again. So I really appreciate the opportunity. Thank you so much, ladies.
Thank you. And yeah, we will call this the end of the meeting, but I will stay on a few minutes so everyone can grab that QR code as needed. And if you're looking on like a phone right now, just make sure you write down the link. And then we will have this webinar recorded and be able to share out the link in the survey later as well. So thank you.
Thank you.
Thank you, everybody. Thank you very much.
Take care, everyone.